Michael Olonite knows the horror of Lassa fever. He survived it. Now he's fighting to stop others from suffering the same fate.
I fainted. I couldn't eat. I couldn't sleep. Lassa fever can be called hell on earth.
But surviving was just the beginning. After his recovery, Michael was shunned by his own community. He says many people in his village think Lassa fever is a curse.
There was a time people said, in my church, they said nobody should go to his household.
Now, he's using his experience to teach others about hygiene, rat control, and the symptoms of Lassa.
Most of the time when I have opportunity, I can come with some pictures to explain, those pictures will speak better than me.
In places like this, poor housing makes it harder to keep rats away. They enter homes, contaminating food. In rural areas, mud brick houses and open doors increase the risk. Lassa fever has surged in Nigeria in the last 2 years, with over 1,200 confirmed cases and more than 200 deaths annually. Lassa fever attacks the organs. Some patients need dialysis to survive. Symptoms like fever and weakness mimic malaria, and the disease is often misdiagnosed. That means it's also likely to be underreported.
Lassa fever is more widespread than is recognized. That's because there's very little surveillance in many countries in West Africa. If you look at the literature, they will talk about 300,000 to 500,000 people are infected in West Africa annually.
And the speed at which the virus mutates could make it even harder to control.
Virus mutate so easily. And Lassa fever has been recognized as a virus that mutates easily. It has several variants, and if a small mutation could give it real pandemic potential. We don't want to see that.
Nigeria is working with international partners to develop a vaccine. But until then, preventive measures are crucial.
At this moment, it's preventive. And then in terms of the health sector, it's pre-positioning supplies, whether it's the personal protective equipment so that the health workers are protected, the gloves, face masks for those who are infected so that the health worker doesn't get inadvertently infected, and the antivirals and the fluid and other supportive interventions that are needed so that people survive.
Survivors like Michael believe real change starts in communities.
I will continue to go out openly and use myself as a picture for others to know that if you have Lassa, you can come out of it.